Well, obesity rates are set to skyrocket, with 1 in 3 children and adolescents in Australia forecast to be obese by 2050, according to a new global study. But with significant increases predicted within the next 5 years, the researchers stress that urgent action now could turn the tide on the public health crisis. Dr. Jess Kerr is from the Murdoch Children's Research Institute, and she joins me now for more on this story. Good afternoon, Dr. Kerr. So why are obesity rates expected to skyrocket, and why is it children and adolescents most at risk?
Yeah, sure. Thanks for having me. So this was a global study published today on World Obesity Day. In terms of why they're set to skyrocket, the drivers of obesity are actually really complex. There's several interacting factors. But what it really boils down to is that children and adolescents and adults are having kind of a biological response to living in a pathological obesity promoting environment. So, for example, what I mean by that is it's really easy for Australians at the moment to access and afford high calorie foods. It's often more affordable than healthy fruit and vegetables. So our environments are making it really hard to be healthy, even if we want to be healthy. Most people aren't aware of these complex drivers, so it often gets blamed on the individual parent or family or child, when really these shifts are due to system level drivers. And we know that obesity increases as a country's economic development increases, and urbanisation and food system changes as well, all really drive high growth in consumption.
Yeah, can you take us through just that element about Australian children and adolescents sort of experiencing obesity at higher rates than overseas? What is it that's happening here in Australia that we're not necessarily seeing in other countries?
Yeah, so we were pretty surprised by the findings in Australia. So we're expecting that by the year 2050, 50% of all children and adolescents in Australia will be living with overweight or an obesity. And what's really worrying about that is that our girls, our young girls and our adolescent girls transition to obesity faster than many other subpopulations throughout the world. So they experience this transition really quickly, along with North America as well. And that might be because they've kind of been exposed to these obesogenic environments for longer. So they're obviously transitioning faster. It's really concerning for our adolescent girls as they're entering their childbearing years, and we know that obesity is transmitted intergenerationally, so it's concerning for our next generation of children as well.
Absolutely. And, you know, our lives are busier than ever. The cost of living is crippling a lot of people. We were seeing footage there of, unhealthy food being promoted on social media as well. It can often be sort of the cheaper and easier option. So how do we tackle that and make healthier options more accessible?
Yeah, well, look, it's a good question. And our message today, on World Obesity Day is really that it's the systems and not the people that need to change. So we need to stop focusing on the individuals, on the parents, on the young person, and focus on the systems. A nice surprising finding was that more of the obesity prevalence is set to skyrocket in the future than what we've had in the past. And although that sounds worrying, it actually means that if we act now, we have a chance to change this crisis. So we really need our decision makers and our governments to step up and make changes to the environment and to policies. So things such as changing the commercial determinants of obesity, such as taxing sugar-sweetened beverages and unhealthy foods, subsidising healthy foods, having stricter marketing and advertising regulations, trying to have an impact on those food supply systems. But also thinking more broadly, health and all policies approach. So also thinking about urban planning and walkability and funding healthy school meals, so that we try and affect multiple policies to try and change the environment that our children are living in.
Dr. Jess Kerr from the Murdoch Children's Research Institute, thank you so much for your time.
Thank you.